Today's our guest is Dr. Prakash Rao MT. He is holding the postgraduate diploma in physical medicine and rehabilitation. He undertook the projects with UNICEF and AIDS Control Society, and he is the winner of many awards for outstanding work for the homeopathy and more than 30 years of experience he have.
I am Vice President Medical for Hemophilia Society of Pondicherry. So this is the building of Hemophilia Society. This was constructed by Indian Oil Corporation as a gift to the hemophilia patients of Pondicherry. This is our team. In between standing is in Jipmer Hospital. I am the secretary. Now we will come to the topic. Many people have heard of tuberculosis, cancer and diabetes. But hearing about hemophilia is something rare. It is a rare disorder, but it is a genetic disorder where homeopathy is found to be more useful than the factor. I will go in details. I have split this chapter into two chapters. This is the introductory, what is hemophilia, how hemophilia will be controlled, what the treatment that will be given. It will be known here. The rest of homeopathic part, the mechanism of action of the homeopathic medicine in controlling the pain and intracranial bleeding will be discussed in topic number 2. So this is the family tree. Where family tree, what happens, the hemophilia spreads. And the family tree of the previously around 50 years back, it was known as a disease of royal families and rich persons. The most the popular person, a VIP person who suffered hemophilia is Queen Victoria, who expired 3 months back, in which obligatory and possible carriers are clearly shown. Here the Queen Victoria is carrier of hemophilia. Usually females won't suffer. They will be only carriers and males will suffer. All the dots without any mark are normal males, and the rounds are, the blocks are normal males and rounds are normal female, and the block is hemophilic patient and the blue color are carriers. So this is the family tree of Queen Victoria, how they carried hemophilia, and at last it came to even the queen has become carrier and she gave to their children, and all the children and their second generation people are also suffering from hemophilia. And I will here go for basics of hemophilia. What are the basics of hemophilia? These all you might have studied in your physiology about the blood culture and everything. But hemostatic system, first is blood vessels, second is platelets, third is plasma coagulation system, fourth is proteolytic or fibrinolytic system. These are the 4 systems. Each system in hemostatic system are divided to understand hemophilia, from blood vessels to fibrinogen. Each system will be in detail studied. That's why they are known as systems. Types of bleeding disorders. What are the bleeding disorders in hemophilia are? One is hemophilia A, factor 8 deficiency. Then hemophilia B, that is factor 9 deficiency. And Van Willebrand disease. This is where woman will be a carrier of hemophilia, and that carrier, she gives birth to child. If he is a male child, he will become the victim of hemophilia disease. If she is a female, she also will carry Van Willebrand disease, that is VWD, and others I will discuss in detail. One is a factor 8 deficiency. Most of the patients will have factor 8 deficiency, and around 30% of the patient will have 9 deficiency. 1 or 2 patients will have factor 13 deficiency. What are these factors? Everything, if you go through hemopoietic system, you will understand that it will be all present in physiology. What is hemophilia? Hemophilia is an inherited bleeding disorder in which there is a deficiency, lack of factor 8, hemophilia A, or lack of factor 9, hemophilia B. This is inherited bleeding disorder. This is chromosomal genetic disorder where the deficiency of lack of factor of 8 and factor 9. And inheritance of hemophilia. Hemophilia A and B, that is factor 8 and factor 9, are X-linked recessive disorders. Hemophilia is typically expressed in males and carried by females. Hemophilia severity level is constituted between family member. More than 30% of the cases are hemophilia are new mutants. New mutants means, suppose if the family is among the relatives, the 30% of the kith and kin will get hemophilia disorders. Joint or muscle bleeding is very common. Tingling and numbness sensation, stiffness, heat around the joint, pain in the joint, unusual limb position. The limbs will be crossed or limbs will be stiff, and the limb movement, the position of the limb, particularly you will understand from the knee joint, how the boy, how the child, how the patient is sitting. While he is sitting, he keeps his foot in a different manner. He keeps his knee joint in a different manner so that the bleeding, warmth and stiffness can be adjusted while he is sitting or standing. And the incidence of hemophilia, hemophilia A, that is factor A, it will be around 20.6% or 21% among the 10,000 males. The severity will be 50 to 60%. What is the severe disease? That is known as 50 to 6. And hemophilia B, that is factor 9, is 5.3 persons per 10,000 males will have hemophilia B. And what are the degree of severity? The degree of severity is normal range of factor 8 or factor 9. Level is 50 to 150% of the serum count. If we test factor, these factors will be tested in a high technique laboratories. Usually everywhere nowadays high technology in laboratory assessment came. So these high technology laboratory assessments are possible where factor 8 and factor 9 are being tested. The percentage of factor in blood is from 50 to 150% of the serum. Then what is mild hemophilia? Factor 8 or 9 level will be 6 to below 50. And moderate hemophilia is the factor, both the factors less than 5%, 1 to 5%, and severe hemophilia is usually more than 1% and less than 5%. Sometimes it will be lesser than 1%. So this less than 1% patients will have all the symptoms of hemophilia like tingling, bubbling sensation, stiffness, heat or warmth of the joint, pain and unusual limb position. So the detection of hemophilia can be done, number one, by family history. They tell that in our family, around now the technology has much developed, but when we started research around 15 years back, even that time the investigations are not up to the mark. So the family history used to reveal that male persons used to have bleeding for more time. Sometimes the father, mother or uncle or somebody used to have swelling of the joints, and they used to die. They died at the earlier age, below 60 years, and just because of bleeding or something happened which they don't know. So that was the status of hemophilia around 15 to 20 days back. But the factor test became very common nowadays. So the family history will relieve the symptoms. Then we have to go immediately for the testing of the factor. Then the symptoms, bruising symptoms, bleeding with, see, usually in Muslims what happens, the bleeding during circumcision, that bleeding will continue for more than the bleeding time. The bleeding time is from 1.5 minutes to 3.5 minutes. So if the bleeding time increases more than 3.5 minutes, then we have to suspect hemophilia. After small surgeries, like in a child, usually circumcision, muscle injuries, falling, dental surgeries, teeth falling, the milk teeth will fall. Trauma or accidents, usually children will have small injuries like after surgeries or tonsillar surgery. So the bleeding will continue and the bleeding time will increase. See, in that bruising, bleeding after circumcision, and muscle joint or soft tissue bleeding, there will be bleeding inside the joint. There will be swelling inside the joint. The muscle will swell. There will be ecchymosis. Ecchymosis is a very common symptom which we find in arnica. So hemostatic challenges are surgery, dental work, trauma, accidents, and how to detect it is by laboratory testing. Types of bleeds, usually in hemophilics, when patient comes to our OPD, when we will have hemophilia OPD, we will check up the hemophilia OPD. Daily, patients will be coming from different parts. Because of awareness, one patient will tell to other patients, so patients will come from villages or from far away distance. That is joint bleeding. This is known as hematothosis, muscle hemorrhage. There will be always hemorrhage, there will be muscle clot, and bleeding will not stop. Bleeding will be going on oozing for more than 3.5 minutes to 4.5 minutes, and it will be going on continuing. Once we apply the bandage, there will be bleeding inside the bandage. Then the bleeding will be from soft tissue. Life-threatening bleeding, suppose there will be piles, there will be peptic ulcer, and the patient was not diagnosed for hemophilia. So there will be continuous bleeding from the rectum. A bright red blood will be going on, coming. So usually doctors will suspect hepatosplenomegaly or ulcer or cancer or adhesions or something like that. Recently, we found out a male patient of more than 70 years having severe bleeding from rectum. Everybody thought that he is having malignancy or colon cancer, but fortunately or unfortunately, his 70 years of life has passed without major injuries. So now he developed a small ulcer-like thing in the stomach. So he started bleeding. As a child, he never developed any great injury. Small injuries were treated with antibiotics, and no doctor has diagnosed his disease. When he started getting bleeding, at the same time, he also got the abnormal swelling of the knee joints, both the knee joints. So by that, the collagenous swelling has been understood, and he was diagnosed as hemophilic patient. The other bleeding episodes are what happens in hemophilia. There will be soft tissue, life-threatening bleeding, muscle hemorrhage, joint, inside the joint there will be bleeding, head or intracranial bleeding. If child puts something to clean his ears, there will be bleeding in his ear. Then if he has having some small injury to the eye, there will be bleeding in cornea. And these head bleeding also, sometimes if he hits head, there will be an intracranial bleeding which will produce intracranial symptoms like nausea, vomiting, headache, drowsiness, confusion, and visual changes. And loss of consciousness also comes sometimes. So if the bleeding is not properly diagnosed after taking the family history, so it will be a life-threatening disorder. Then there will be neck and throat bleeding, pain, swelling, difficulty in breathing, because if there is neck injury, there will be bleeding around the neck, and the neck swelling will come. Everybody thinks that it is only because of injury, next day it will come, but it won't come down. And the bleeding in between the neck muscles and the neck superficial fascia and deep fascia, internal bleeding will take place, and it compresses the trachea and esophagus, and there will be difficulty in breathing, and there will be difficulty in swallowing. Then life-threatening bleedings are abdominal and GI tract bleeding. I told the 70 years old patient, who is unfortunately not diagnosed as hemophilic because he never got any disease in his lifetime which will produce the bleeding. Only small things came. He has gone to a local doctor. Somehow they came down. But when at the age of 70, he developed continuous bleeding. The patient doctors thought that it is because of malignancy, and it is not because of malignancy. Later, it was found that he is suffering from hemophilia with factor 8 deficiency, and after giving factor 8, he improved. In this abdominal and GI tract bleeding, there will be pain, tenderness, swelling, blood in the stools. Always blood in the stools will be the symptom. Then iliopsoas muscle bleeding. What happens? These hemophilics who don't produce any symptom, if they lift some weights or if they do something what you call exercises, when they go to gym, so they develop iliopsoas bleeding and there will be back pain. It mimics like renal calculi. The back pain mimics like renal calculi, abdominal pain, high tingling, numbness, decreased hip range of movement. What happens in iliopsoas bleeding? One cannot stretch the legs. One cannot stretch the hip. He cannot stretch the hip if not 90, if not around 180, but at least 90 degrees angle. He cannot keep both the legs separated, and because the iliopsoas bleeding, there will be back pain also. The pain will be acute. It mimics like renal calculi. The other bleeding episodes are bleeding from mouth. Bleeding from nose is very common symptom in hemophilias. Scrapes and minor cuts, where when they shave, that bleeding never comes down. But in male hemophilia patients, when they shave, that bleeding comes down because it is from skin. That also takes more than bleeding time, but the clotting takes place. But if the cut is little more deeper, then it won't come down and the bleeding with clots will be going on coming. So what are the complications of the bleeding? The complications of the bleeding are: number one, flexion contractures. There will be, when we flex the legs, there will be contraction. There will be contraction during the sleep that happens, and it also will aggravate when patient sits and gets up. Joint arthritis and orthopathy, in the sense there will be a bleeding, and that bleeding will produce joint pain, and that joint pain will be severe tender in nature, and he cannot fold, he cannot stand erect. Chronic pain will be continuously present. There won't be acute pain, but chronic pain, whenever we press, patient pain will increase. In osteoarthritis, in other pains, whenever we do little massage, patient feels happy. But in hemophilia patient, if the muscle or chronic pain is present, if you press, the pain will increase. And muscle atrophy, the muscle that is surpassing the joint, above the joint and below the joint, the thigh, if the knee joint is affected with the bleeding, means the thigh muscles, the sartorius and the sural, these muscles will be atrophied, and cuff muscles will be atrophied. There will be a compartmental syndrome, in the sense the clot will be present somewhere in the leg and somewhere in the muscle, and the muscle compartment, there will be a round atrophy will be found. In neurological atrophy, there won't be any strength. Here the muscle will be present, but a place of muscle will be atrophied, and gradually he will develop neurological impairment. The treatment of hemophilia. What treatment usually hemophilics will have? Number one is replacement. Now first we will learn what is the physiology and how the physiology is applied. What is the treatment that is usually available in allopathic system of medicine? We will try to know that because that is physiological. Replacement of missing clotting protein on demand. If the protein is needed, if the fibrinogen is needed, we have to replace it. And prophylaxis treatment. In replacement treatment, first we will see what DDAVP. DDAVP means desmopressin acetate synthetic NLR, 1 ion of dimino, 8 of dearginine vasopressin. This is a anti-diuretic hormone. It is L-arginine. It is a vasopressin hormone. The vasopressin will be secreted from the when the renin is secreted from the kidneys. The vasopressin will increase. The renin will increase when adrenaline is increased. If this vasopressin vaccine is given, the hemostatic properties is boost the factor level 8 that is present in the body, that is present in the blood, that is present in the serum. And if the factor 8 increases, then the disease will be under control. Usually this happens in von Willebrand factor defective patients, usually females who will respond because they are the carrier. But a male boy who is suffering with factor 8, he will not respond with DDAVP treatment. Then this is where we do in our hemophilic center. We will give the factor infusion. Factor infusion is factor 8 and factor 9. These factor 8 and factor 9 will be, we will preserve it, we will purchase it. The National Hemophilia Federation will supply. But this is not the end of the treatment. This is only control, where homeopathic plays an important role. I will explain you. Then the treatment of hemophilia, the other thing is anti-fibrinolytic agents. Then we will come again the physiological part of the control of the disease. This is EMICAR. This is known as anti-fibrinolytic agent. Supportive measures. What supportive measures? This after giving fibrinogen also, the swelling never comes down. The bleeding will be stopped, but the swelling and pain will be present. For that, icing, we have to keep ice on the affected joint. If there is iliopsoas bleeding, we have to keep ice on the abdominal muscles and back. And if there is bleeding in ankle joint, we have to keep ice. Then other is immobilization. We have to see that the patient should not be mobilized. He should be always kept in rest. And after this, he improves gradually. All the types of physiological treatment, painkillers, NSAIDs, non-steroid, anti-inflammatory painkillers. So these NSAIDs must be given. They will give. Now, once this has been given, what is the defect with all these things? So they thought of complementary and alternate systems of medicine. Why they thought? The road for treatment has over. Road of treatment is when the factor 8, factor 9 has been induced, the bleeding will be stopped, but patient never recovers. Patient normal physiological condition, patient pain and swelling must come down. So around 13, 15 years back, what happened? Usually children from the age group of 0 age to 12 years who used to have these bleedings and defects, there are in our society, we have around 345 registered hemophilia patients. But most of the patients, they manage themselves without any injuries. Their father, mother, their family will look after. But there will be always children. Out of these 345, we have 65 patients who will be having recurrent complaints. Sometimes the factor 8, factor 9 has to be replaced. Even now the factor cost is around 4,500 rupees, where poor children will not get it and they succumb to disease. So when they come in the middle of the night, the local doctor has to be informed that he is a hemophilic patient. Otherwise, he takes another 2-3 days to diagnose. By the time the reports from the pathological laboratory arrive, patient will have total bleeding and he will surrender to the disease condition. So what we have done is, we have formed a Hemophilia Federation of Pondicherry. There we will register the disease. Whenever the patient comes to Jipner Hospital or GH of Pondicherry or to any other private corporate hospital, he telephones to us. Then we will go with the factor to that particular hospital and we will hand over that factor to the hospital and we will show his blood reports. We will inform that he is a registered patient with us in the Hemophilia Society. He needs special treatment. As you think your diagnosis is may not be correct, he may be suffering with hemophilia and he's bleeding intracranial or psoas or neck bleeding or muscle bleeding, or if he suffers from piles, or if he comes with injuries, kindly treat him with injuries, thinking that you are treating a hemophilia patient. You need not waste your time and energy on blood supplements. Kindly go to this factor. We will check their hemoglobin instantly in their hospital. If the hemoglobin is up to the mark, we will hand over a factor from which the patient is suffering from, and the patient will be managed. Like that, it is being done from last 30 years, and from last 15 years, I joined hands with this hemophilia society. Then where homeopathy stands, I will tell you. When they thought that these bleedings have to be controlled, means we have to give side by side the alternate systems of medicine. Being myself present, I started giving homeopathic treatment. So apart from this factor, there will be prophylaxis. What are the prophylaxis? Number one, fibrinogen. Number two, vitamin K. They will be infused, and factor in between. If the patient suffers with any disease or without any disease, the factor will be always given to the patient once in a month to prevent unnecessary bleeding, because it is a physiological dose. Like what we need food or water, the factor must be always has to be supplemented to the patient 2 to 3 times weekly to keep the factor 8 or 9 levels at above 2.3%. What is the normal percent? 50 to 150. If we keep the factor from 2 to 3% with the factor in infusion, that is a factor that costs around 4,500 rupees, and we give 2 to 3 times in a week when he is acutely suffering, to keep the factor level in the blood from 2 to 3%, and the patient will improve. So this became costly, non-availability, and social support. The hemophilia society support, then only a poor patient or even rich patient will survive. Then what happens in prophylaxis is the types of primary prophylaxis, secondary prophylaxis. Use of implanted vascular access device. What these, when the patient suffers with acute disorder, what we will do is we will make an IVAD necessary in our hemophilia center, and we will keep that intravenous um, shunt, and we will manage him for 15 days. So these all became a painful episode. So there was no other go except to allopathic doctors to try the alternate systems of medicine. So let me continue the normal treatment of the hemophilia, even with homeopathy or with allopathy. After prophylaxis, what a hemophilia patient needed is psychological issues must be answered. Patient feels guilt because he is around 15 years, 16 years, or 12 years old boy. He cannot run. He don't know that he is having a life-threatening disease in him. It can be managed with the factor and homeopathy throughout his life, but he is a patient throughout his life. He should be careful. He should not fall from the cycle. He should not drive the motorcycle. If he drives, he should not fall. He should not have injuries. And if the boy grows, if he develops secondary sexual characters, he should be careful while shaving. So all these things makes the patient to feel guilt. And challenges of hospitalization. Once he is hospitalized with intracranial bleeding, with psoas bleeding and abdominal bleeding, neck bleeding, he will be in hospital for about a month to 3 months. And control issues, how to control, nobody, the uneducated family, they don't know. They think that because of sin this disease came. Then all these issues will make patient guilt, and financial and insurance challenges. Our government don't have any proper infrastructure to give treatment to most of the disease condition, not only hemophilia. A poor patient, if government hospital gives him any treatment, after undergoing all the step by step the burden of the disease, whoever surviving is surviving, and whoever dies, they die. Why I am telling like this is, when we study, if we see the dead bodies that are present for anatomical investigations, when we studies as a first year student, when we go for anatomy, there will be bodies lying around 100 to 200 people, because all the people will die. No, their relatives will take care of them. Because of lack of financial support, nobody understand their disease condition. So all the hemophilics, schizophrenia patients who die as a destitute will lie in the hospital. So it becomes very easy for medical students to dissect that body and learn the anatomy. And this is the thing, the financial reason. Our government don't have, there is no planning. And though planning is coming, in the implementation, after implementation, execution, after execution, all these things reaching to the patient's benefit are very tough. There should be a local leader who will do everything. So you will understand all these problems when a patient is undergoing treatment in any star hospital or in any government hospital, whatever the government is producing the free treatment for them, how they suffer, you will understand. And nursing considerations. What are the nursing considerations? Factor replements to be given on time, laboratory monitoring, increased metabolic states will increase factor requirement, factor coverage for invasive procedures, documents, infusion, response to treatment. These all must be studied. It is a total, this disease condition is total scientific study. Neither it comes under cancer where malignancy is present. A physician will understand he definitely dies, no other treatment is available. But hemophilia is such a thing, if he properly manages, they survive up to the normal course of the life and they will enjoy their life. But for all these things, a discipline, a systematic review, everything must be carried out. And unnecessary usage of NSAIDs, non-steroid anti-inflammatory drugs, that is paracetamol, analgin, novalgin, aspirin, anti-inflammatory drugs. They are not steroids. If they use more, the bleeding also will increases more. There the RBC will come down, the factor levels also will fall down. If they won't use, the body pains and joint pains won't come down. This is the headache of allopathic treatment. So there comes the homeopathy. Utilization of hemophilia center staff for questions of problems. What we do is, we will understand the disease condition. We will give them the factor. If they needed any hospitalization, we will take them to the hospital. We will admit them side by side. We also will give the intermediary treatment, that is homeopathy, where it is has shown maximum results, where I have studied properly according to the procedures of the protocols and biological changes that homeopathic medicines have produced. I will show you. Then the hemophilia treatment center team members whom we continue is patient and family. What we need: hematologist, nurse, social worker, physical therapist, orthodontist, or orthodontist who will think of dental problems. These all persons should check the one hemophilia patient. So we will have once in 3 months this orthodontist. Social worker is present. One of the hemophilia member is a social worker. Physical therapist will be always present in our team. Nurse will come and give factors, and hematologist is one of the members. And patient family members, they will be educated. They will be made aware. They will be made to know what is hemophilia. Then hemophilia treatment center also contain primary care in our center, infectious disease control, genetic code changes where we will take blood samples and send, and we will have our own pharmacy where factor will be given, as well as homeopathic medicine also will be given. Hepatologist is also present in our society as a member. Now, role of homeopathic treatment: state-of-art medical treatment for persons with hemophilia. They have to be provided. If we have around 100 patients, 10 patients may develop some of the physical defects, physical deformities. but we will see that 80% of the patients will continue their normal life with their happy married life, with the children and their education. And we will get some of the scholarships from government and from donors. Then there will be research, particularly they are doing research with homeopathic medicines. And the outreach. Outreach means we will explain them. We will find out the new disease condition among their relatives. We will go to door survey, and we will do all these things. And model comprehensive care for chronic disease. What is the model comprehensive care is? It is designed by us about homeopathy, the total team, and homeopathic treatment and homeopathic management will be looked after by me. And what are the complications of the treatment, whether he has been treated with homeopathy or with factor? What the patient will develop is hepatitis A, hepatitis B, because always loss of blood with fibrinogen, which will have less resistance. So if he eats any hotel or in anything, the body will not have resistance. So definitely they will have hepatitis A from footpath foods, or hepatitis B or hepatitis P. The other disease condition that will affect with contamination among the hemophilia is HIV. And the inhibitors, chronic continuous infusion of factor 8 and factor 9 will patient will develop antibodies even after certain time. The 80,000 million doses of factor, 80,000 ml of factor has been induced to the patient in his lifetime, means that factor won't work. There the patient is bound to come for homeopathy. So these are the things, these are the complications of the treatment. But most of the patients respond. But despite, many patients need many times factor, that factor itself will produce antibodies. And this is one of the patient, a boy of 12 years old. He is having severe headache. Here shunt has been given, where we are giving in our center the glucose drip, as well as we will induce the factor 8. He will have severe headache, conscious. Why we kept them in center? Because fellow is under consciousness. He is not having vomiting, but he is having severe headache. We have sent him for one scan. There he developed intracranial. They don't want to admit. So we have 1 or 2 beds in our hemophilia center, where we will make him to lie down, and we started giving this along with homeopathy also. And this is the bleeding in left knee joint. If you see any patient below the age of 20 years having swelling of the knee, not gone to any doctor, and if the doctor treated, the pain came down, but despite patient survived with some defects, you will find that patient is unhealthy with such type of swelling. You kindly think along with rheumatoid arthritis, juvenile rheumatoid arthritis and other conditions, along with hemophilia. And this is bleeding in hand, which will look like ganglion, but this is not ganglion. This is a bleeding of the hand. Inside the hand, the bleeding is taking place. That's why the swelling come down. For this, we will apply ice. Factor will be tested. If the factor is more than 5, they won't give any factor. There the homeopathic treatment will be induced. He will be made all right. And bleeding in the knee joint. This is the knee joint of a patient of 16 years old. So the swelling, this is intra-articular bleeding. There is bleeding inside the synovial membrane. There is what you call fluid present in outside the synovial membrane because of the infection. These are the both knee joints. Now this knee joint has been affected. This swelling won't come down. With homeopathic medicine, the pain will come down. If the physiotherapy is continued for more than 3 months, the swelling may come down. Because of the swelling, there will be also striae, the white patches, because of the folding. This shows the protein deficiency in the patient, because he won't eat and he will be suffered. He will be a boy of 16 years. And this is a common problem, a teeth problem that comes among the patients of hemophilia. At the age of 5, the milk teeth will fall down. After falling of the teeth, he will have bleeding. All these days he fell down, there will be swelling. The local treatment will be given. The doctor will give anti-inflammatory therapy and everything. Despite that, patient will improve, but after certain time, this bleeding won't come down. So patient will come to our hemophilia center. And here comes need of the research. This is the factor. This is homeopathy. Now both have to be integrated. Then only patient lifespan will increase and patient will continue the normal life. Otherwise, mere factor is not sufficient. The allopathic treatment where the treatment limitations are understood means that is the only hemophilia disease condition where treatment limitations are understood, and this is the disease. Now, hemophilia, what we do? What we do is I will show you the hyperlink. It is opening. Just a minute. Hemophilia case record. A separate case record has been designed by me. That has gone. That has given a new because I introduced today. This may be the case record. I think no. This is today the integrated approach. You kindly see. This is most important for every homeopathic doctor. Center to create separate division for integrative medicine at all medical colleges. What is integrated medicine? Now they cannot criticize any Indian systems of medicine and homeopathy. They are found to be effective, and the allopathic doctors, when their treatment is finished, without trying the integrated medical approach, without trying the other systems of the medicines, the patient will not be discharged. And this is going to become a constitution in future. Now today he declared in Hyderabad, yesterday on 18th, our health minister Mansukh Mandavya has announced that every hospital will have integrated medical practice. Once the super specialist fails in his treatment, he has to call the alternate systems of doctors and ask, can you give any treatment? If you won't offer any treatment for them, then only I will discharge this patient from this hospital. Otherwise, no. The Ayurveda treatment, the homeopathic treatment goes hand in hand. This is the paper statement I am showing to you. So for uploading this, I could not show you. That has disappeared. Where this is the same thing. So the case record has disappeared. Now come to the homeopathic particular treatment. What happened is serial number 1, total number of patients screened. This is how I started giving hemophilia treatment to the in hemophilia center Pondicherry is in 2012 when the severe bleeders have increased, when they started disturbing the executive committee members of Hemophilia Society of Pondicherry. So we used to go to always the casualty medical center of Jitmer Hospital or General Hospital Pondicherry, and to save the patient we used to supply the factor as well as stand there and give them money because they are poor patients. So then the executive committee thought of me and they called me, they handed over me the 28 patients. So with the 28 patients who are little less serious were handed over to me and their blood samples were collected. The total number of patients treated are 13. The acutely suffering patients are 28. Out of 28, 13 were selected by them, that is by allopathic doctors team. The total number of patients improved are 8. And the total number of patients not reported are 5. Why they haven't reported? Number 1, no improvement came. Number 1, exact improvement came. Number 3, they might, the symptoms might have decreased, or they might have gone to other hospital which are very near to their vicinity, maybe in Tamil Nadu or borderline. So the 5 patients I haven't got. Later when we contacted, I came to know that 1 patient also improved. Why we will do that work in research means I have to know exactly what is the efficacy of the medicine. So out of these 5 patients also 1 patient increased and 8 patient increased. Patients are under continuous treatment. 8 plus 1, 9 patients have improved. So what are the medicines that have been given? Number 1, see everything repertorized. After repertorization, we have to find those standard symptoms. These all the medicines, these all the patient sign repatriation potency, they are for rescheduled. Rescheduled means they can be repeated. Anybody, any homeopath, whoever see any type of hemophilia of this range, that protocol was also designed and that is also present. It is not my mind, but what is the thing I know is how arnica works, where arnica works, how many days it works. This is not known to general physician. They need not know also, but they can repeat the same system of medicine depending on the same symptoms. You need not go for mental symptoms. You need not go for constitutional symptoms. All the constitutional symptoms are present in genetics. Those genetics became chromosome. Those chromosomes again tissue. That tissue is present in the body. That presence of the body has given rise and gave rise to the disease condition. So if we properly understand the disease condition, we also will understand the mental status of the person at that particular time. Depending upon the social and economical condition, the mental symptoms will be present. So you kindly see the pathological symptom. This is arsenic given into belladonna 2, calcarea carb, and number of cases found effective. One in arnica, 2 by arsenic, belladonna 2. Why these two? Whenever we show the 100% result, that means according to research, it is not up to the mark. But these two patients have recovered for acute phase, not for hemophilia, totally cured. The other medicines are Merxal, phosphorus, Laxis. The total number of patients are 13. 8 patients found to be effective. 5 patients have not improved. This is the international reputed pediatrician who will look after. She is the president, who will guide me and who will help me, who also will homeopathy. All these hematologists, immunologists, hepatologists, pediatrician, all together with homeopathic doctor, they are not biased, they are not worried, they are not worried about the science. They will see the protocols, they themselves will test the blood and they will help me. Now there are 345 patients. Because of corona, the acute patients from 45, they have reached to 126. All the 126 patients have been managed with homeopathy. I will go to Hemophilia Society daily whenever the patient calls. Otherwise, every month there will be a camp where all the patients are asked to come. Those camps will be held once in 15 days to split the patient properly. They will be assessed and the monitoring will be done and the scale pain. And he is the person, now he was the 12 years old boy who has improved with calcarea carb. Now at the age of 23, he himself is managing himself. Now this boy is in Canada. Now he is happy. He is playing piano. He was on factor and homeopathic treatment. Now no more factor. He himself is managing with food and homeopathy. The medicine is calcarea carb. And this is the physiotherapeutic exercise which we will show in our Hemophilia Society under the supervision, under the guidance of all the doctors. And these are the children who are suffering from hemophilia.